Let's bring you this conversation now. Health Minister Dr Aaron Motsoaledi has revealed that the public sector will add 1,650 jobs. This is aimed at addressing critical staff shortages following protests at various hospitals and clinics. The minister also revealing that funds will be made available to fix infrastructure and equipment. The minister joins us now for some discussion around what he has announced today. Minister, good evening to you and thank you for your time. Can I start with just a general observation between the public health care sector and the private sector? Those that have experienced the public sector say the biggest differentiator is simply the hospitality care while you are in a hospital as opposed to clinical care. Do you agree with that assessment?
Yeah, just come again. You said, yes, I know there's a difference between clinical care and hospitality services in public and private, but what is the question?
The question here, Minister, is that if the Tom London experience is anything to go by, how do you improve or close the gap between experiences in the public healthcare sector versus those that go to private hospitals?
Yeah, no, thank you very much, Colin. Thank you to the listeners and viewers. If you look at the London saga in Helen Joseph Hospital, he presented 7 complaints to the health umbad, Professor Taule Mokoena. And out of the 7, 5 were dismissed as having no basis. And those 5 is about clinical care, whether doctors did what they were supposed to have done in a way that is expected, etc., etc.
Yeah.
But the other 2, which were upheld by the health umbad, is about hospitality services. It's about infrastructure, cleanliness of the hospital, the number of human resources and all that. And that is where our problem is, Goli.
Yeah.
And that's what we regard as the biggest difference between the public sector and the private sector. And that is the part that we are determined to correct.
And I'm glad that you and I agree then, Minister, because this massive investment that you announced today, 1,346 billion rand. I mean, that is huge, Minister. Importantly,
1 billion.
Sorry, 1 billion. That is huge. Yes. If that is to be spent efficiently, how do you plan to go about it and ensuring that there are safeguards for what is to be procured?
We have already got a list of what is to be procured for 1.3 billion, Goli. Firstly, we said beds, ICU beds, general ward beds, 3 section electricity beds, 4 section electricity beds, and multi-function electricity beds. We're going to pay 25,000 of those. Then the issue of mattresses, both ordinary hospital mattresses, pressure mattresses for people who might develop a bed sores because maybe they are paralyzed, they can't move because of strokes. Infant cot mattresses, we are going to buy 80,000 of those. Then it comes to bassinets. Bassinets are these small, very small beds for newborn children. You'll remember, Koli, we got very embarrassed some few years back where these newborn babies were put in cardboard boxes in Northwest because they did not have bassinet. We're buying 76,000 of those bassinets. And then we come to linen. That includes bed sheets, pillows, etc., to make people comfortable. We're going to buy 1,250,000 of those. And yes, the total is 1.346 billion rand. And because we've already announced it at the national level, this is what is called the transversal tender. Companies that supply this type of things are already there. They've been selected by Treasury long ago in what is called a transversal tender, which everybody can use. All that provinces need to do is to choose a company there and order among those companies already pre-qualified by Treasury. All they have to do is to order and say, I want so many beds in my province, because we already know how many must go to each and every province. So these numbers here are a guesswork.
Yeah.
It's what from October we've been talking to province and asked them, how many beds do you need, such that there won't be a shortage, and things like what happened in Helen Joseph won't happen in your province. They gave us the number. So these numbers we are quoting here is what we got from provinces.
Minister, you will know that there are strong critics of the healthcare sector, and one of those is the Progressive Health Forum. Its convener, Dr. Aslam Dasu, talking to us this evening. I'd like for you to just have a listen to what he had to say specifically around the procurement processes.
So this minister sits here and tells the country, well, we've worked this out and we'll get 1.4 million items now purchased. What he doesn't say is why that was not done routinely in the first place. And second, how is this going to be done? If it's going to be done through the same corrupted tender system that provinces use, I can assure you the money will run out before you even know it to purchase these things, because that's what routinely happens. I'm pleased that they found money to employ the doctors. The public service needs those doctors. It's not that the doctors need jobs. I heard in his press conference, well, we have high unemployment and they can't complain. That's utter nonsense. We train doctors to meet the demands of the public service. The public service has the demand for these doctors. What's happened to the supply? What's happened to the money that was given to the provinces to fund the employment of these doctors? They never speak about that.
Is that fair criticism, Minister?
No, that's rubbish, actually. Absolute rubbish, I must put it that way. Because the man you are talking to has never, ever, at any stage, given credit where it's due. Firstly, this money which he said was given to provinces to hire doctors, you are aware in the media statement, Goli, we said there've been austerity, and Treasury has confirmed it by the minister during the budget. For the past 10 years, there've been huge austerity measures where we could not hire doctors. And the minister said he wants to move away from that austerity. He said he's tired of an austerity budget. And I'm sure you heard him, the Minister of Finance. Now, this is the beginning of moving away from that austerity with the money he has given us. And we are saying, of course, we can't solve the problems that accumulated over 10 years in 1 year, but it's the beginning. And for him to believe that this money is just going to be stolen, etc., that is absolute negativity, which is known for about the public health sector. I am telling you here now, Polly, we sat in a meeting for the whole day today with the provinces, and I'm telling you, we got the needs for each and every province. What is left is, out of the 25,000 beds, how many does each province require? And when they require those, they are not going to issue a tender. They are just going to make an order, because I told you these companies were long pre-qualified, meaning the companies that sell beds, that sell mattresses, that sell all this electric equipment, electric beds, are already known. They were pre-qualified by Treasury, not us. All provinces have to do is to order. And when that order arrives, pays. What can be difficult with that? Where can somebody find a room to steal when things are done that way? So we can't stop him from having his own ideas and saying we are talking rubbish and all that, but we are going to do it, and perhaps you'll ask us, Polly, after these orders have been done, and whether any money has been stolen, you'll come up with it. Not for somebody who's disappointed that the problems are being solved and is even asking us, why couldn't it have been done long ago? We have given the answer, it couldn't be done because of austerity. And the Minister of Finance says moving away from austerity. Same as money for hiring doctors. Because of austerity, we couldn't. But the new budget that has been read on the 12th of March give us a possibility to do all these things. Yeah. That's why we're announcing them. I could not have announced them in January because we're giving nothing, and we said so.
All right. Although, Minister, although you and I will have to admit that issues of corruption in the public healthcare sector are well documented. So there has to be healthy skepticism when government says we are changing how we have always done things. That's fine. We're going to have to monitor and see how things are done. Minister, yes,
healthy skepticism, healthy. Yes. You put the word healthy. What I've just heard there is nothing healthy about it. It's just absolute hatred and dismissal and all that. You said healthy criticism. You are doing health criticism, and I answered you how we are going to make sure that this problem is like this. We want every patriotic South African to be happy that this problem is being solved. Not to say, yeah, we know it's not going to happen and all that. And I'm challenging you, Cody, after these things have been ordered, call me and tell me if there's any cent which has been stolen from these orders of 1.4 million articles. Agreed. He can't come here and say, yeah, the minister come here and tell the people 1.4 million. He doesn't tell us the money is going to be stolen. I am saying to you, we are going to order 1.4 million articles for 1.3 billion rand, and that is going to happen.
All right. Minister, let's not get stuck in Dr. Aslam Dasu. Let me squeeze in this final question, and very quickly, if you can. The power of provinces. Do you think that there is simply too much power that health MECs wield over national? And do you think that that needs to be fixed? Because sometimes I have spoken to you in the past, and you really are at a loss sometimes, unable to explain why provinces are doing things in the manner in which they are.
We have raised this with the minister, even this morning for your information, before I went to the press conference to make this announcement. I have spoken to him. This is the issue called equitable share. That's where the problem is. And I said to the minister, we need to resolve it. Equitable share means the amount of money that is sent to provinces from Treasury via the National Department of Health. And the money, once it lands in the provincial coffers, in law, the province has got the right to do whatever they want with it. That's why today we have to get agreement from them in these meetings. That's why when I announced this procurement, all provinces were there, and they know that they can't spend this money on any other thing because it's per agreement with them. We did not push it down their throats, it's per agreement. But we thought, and in the Department of Education, they hold a similar view. If you call the Minister of Basic Education, he'll tell you that when you solve the country's problem, the country as a unitary state, and you send money into provincial coffers and say they must do what they want with it, obviously they won't do what you are thinking. If you say this is the money, please go and buy hospital beds, linen, etc., and the province just say, no, our biggest problem is water. What are you going to do at national level? And that is the problem about equitable share. Now, if you go to read the speech of the Minister of Finance, he actually said that. He said, I'm sending out this money, but once it arrives in provincial coffers, the provinces legally have got the right to do whatever they want with it because it's equitable share. He was saying so because I had raised to him in cabinet that the problem is you are helping us to reverse this austerity, but the money may not be used in the way we want. And he said, unfortunately, it's the law. So in order to make sure that doesn't happen, we put it in front of MECs and their HODs today and discuss these issues, and they all agreed. It will be a very sad day if they deviate, and I don't think anyone of them will do so, because everything I announced here is with their concurrence, regardless of what the law says about equitable share.
Minister, we're going to have to talk once these monies reach provinces and once the actual healthcare space is sorted out. I'd love to continue this conversation when that process starts rolling. But for the time being, thank you very much for your time.